We can just kind of get started. Very small meeting today. But that's okay. So we can just get right into it. First, we can just do some introductions going around the room, introduce ourselves. So do you want to start?
Sure. Amanda Gomez with Restoration Society.
Leslie Thompson, Social Security Administration.
Sweetia Pocotel, also from Restoration Society.
I'm Andrew Deering with the Homeless Alliance, and I'm the SOAR local lead. Okay, so just a recap of some of the things discussed last week. I know we talked about having a SOAR webinar, getting started, which we did. It went pretty well. It was like a 10, 15 person people who signed in were listening into the webinar. And I did get a chance to record it, so that is on our website now. So if you want to kind of, people say, oh, what's SOAR all about, or how do I go about getting trained, I would refer them to that webinar. It basically just shows you what the website looks like, all the different elements of being trained, what's involved with that, and also just some of the basics around SOAR.
How long is it?
The webinar is, that's a good question. Yeah. It's really basic though. It's not like, it's not, I think it was people thought it was like a walkthrough through the training step by step, but it was really like an introduction to what's involved in getting trained, what the website looks like, what's going to be expected of you, and some frequently asked questions, things like that. And I modeled it very, I modeled it after a SOAR webinar that already exists. I just kind of catered it a little bit to our community. So there's also that route as well. You can just go straight to the SOAR website, and you can download like the slides and everything. So there's that.
That's perfect.
And yeah, so we're still trying to get people to get trained. It's still going along. I'm getting emails all the time of people getting trained or wanting to know more about SOAR, which is great. And also on the same, I've been using my Homeless Alliance account on YouTube to just post all of our meeting minutes and everything, all the meeting recordings. So if anyone misses a meeting or just wants to catch up on what was discussed, or like a refresher before you come to one of these meetings, feel free to check that out. So that's all on the same YouTube account. I have links to it on the Western New York, the Honey website with all the SOAR links on it and everything. So it's all there now. Let's see. So the next item says tracking local partnerships, but it's really supposed to be just like tracking progress. And this is probably the majority of the discussion I wanted to have today, is that we really need to focus more, or start focusing more on like how if this process is even working. So like who's doing applications, who's seeing successes, where are the challenges, where are the successes, benefits, things like that. So I did come up with this little questionnaire that I'm planning on reaching out to everyone who's SOAR certified every like 3 months. So we can go through it, and I know Sumitra, you've done a bunch of these, so like, let me know if something stands out, like if you'd be comfortable answering all of these, or if it's something like, oh, that doesn't really make sense, that wouldn't help at all. So the first couple of questions would just be like your contact information, and then the meat of it, I would say, would be applications using the SOAR process. So total SSI, SSDI initial applications approved, total denied, just total initial applications in general, total initial applications for identified veterans, number of days to initial decision, so that would be from submission to decision, total SSI, SSDI appeals approved, total appeals denied, total appeals submitted, and also total appeals for veterans, and also the average number of days. Because the idea is that SOAR is going to help not only increase the amount of approvals, but also decrease the amount of time to the decision. At least that's the thought behind it. So, and then a couple other important information. So, number of applicants for which a 1696 were used. These are kind of just to see what elements of the SOAR process were used and if they're helpful. So 1696, was it used? Number of applications for which a consultative exam was required. And that's asking because if you provide all the necessary documents, a consultative exam hopefully will not be needed. Number of applicants who were experiencing homelessness. How long were they homeless for? A lot of times you can see this in HMIS data. Number of applicants who met the definition of at risk of homelessness, number of applicants who were housed while application was pending or after decision received. Average number of months to housing once benefits were approved. Does this kind of make sense so far, like everything being recorded? Yeah. Okay, so some questions about reimbursements. So Medicaid dollar amount eligible for reimbursement to healthcare providers as a result of SOAR. Total number of persons for whom Medicaid reimbursements are based. Medicare dollar amount eligible for reimbursements to healthcare providers as a result of SOAR. Total number of persons for whom Medicare reimbursements are based. Total general assistance dollar amount eligible for reimbursement. Total number of persons whom general assistance reimbursement are based. Total number of persons receiving TANF. Total TANF amount saved upon SSI, SDI transition.
How would we find that out?
Right, 'cause I'm that too.
Yeah, I mean, we do document income in HMIS. So if that person is homeless, you could see just like how much they were receiving in TANF. And I guess the idea would be if they're receiving SSI now, that kind of gives them more opportunity to use their TANF benefits for other things.
That's a lot of work for somebody.
Yeah.
I mean, in all honesty.
Yeah. Yeah,
and
that's.
then you're talking about for every person that they worked with.
Mm-hmm.
Yeah.
Yeah. So, Well, if somebody only sees like 2 or 3 people within the amount of like 3 months. No, I mean not you. You
No,
see all
but I'm
of
just
them.
saying, I know from, I mean, if somebody asked me to fill this out,
Okay.
you know, amongst my other duties
Okay.
as assigned, that would be very intrusive.
Okay.
That's a lot of work.
Okay. I mean, I could probably scale that back a lot then. I mean, anything on the reimbursement list you think would be, like, with linkages to Medicaid and Medicare, do you think that might be useful?
I almost think it would be more beneficial and kind of easier to do is if you have like a before survey and an after survey for each person. So like as you're doing the application, you write out how much do they get in this, how much do they get in that, what's your average use of Medicaid, and then after they get it, then kind of relook at it. And I don't know, it seems more like a feasible. Yeah, yeah. I don't know, that might even be more work because then you're doing it twice, but it might be easier to keep track of, like, because trying to find the average of everything and you're thinking, okay, well, this person was, you know, X amount of dollars, this person was that amount of dollars. It just, I don't know.
Right. Yeah, I mean, yeah, that might be, if we're trying to scale back the work for
Yeah, because you're doing it
for
twice.
people, that might be, but this is definitely
Yeah.
like the most comprehensive kind of form I could find, and I kind of adapted it. So I could try to make it simpler just to see like how many people had TANF benefits, something like really basic, so
Right.
you're not like fishing around for dollar amounts, how many people were on SNAP, do they have access to Medicare, Medicaid, like how many, one, just like a tally.
Yeah, maybe.
Well, that would be,
Yeah, yeah, like
That's
the stroke
easy.
thing.
Yeah.
Okay.
Yeah, that would be.
Easier, but.
Sure. Yeah. I think we're also just trying to track like additional benefits to getting connected to Social Security. But yeah, so I can.
I mean, but that kind of, I think, in a sense, if the person's getting, then that's kind of presumed, right? I mean, some of these things, if they were getting public assistance before and they're not getting public assistance now, I mean, you know, so I guess I was saying, you know, is that person getting Medicare? Is that person getting SSI? I guess they could do it. Medicare, Medicaid dollar amount. Yeah, that one.
That might be too much. Sure.
Total number of persons who will receive Medicaid, that would seem like that would be a stroke thing.
And
Medicaid, all the dollar things, Medicare dollar eligible for reimbursement.
yeah, and it's funny that this is actually what the TA Center sent me when they were trying to like determine how our community was doing. So I was like, I have no idea.
So I'm thinking too, Medicare, you're not eligible for 2 years anyway, right? Or like
No, you're right, 24 years.
it's a 24-month.
Wait years before you can get it.
Right.
But usually we take about the longest.
Oh.
We'll
be fine.
Keep strong.
So you think, so would it be, so would it still be useful asking if they were linked to like Medicaid upon receiving?
I mean, if they get SSI here in New York State, they're going to get Medicaid.
They're going to get it.
Yeah.
Yeah.
Okay.
So I mean, if they've been awarded, then they're going to get it.
Okay.
I mean, so I mean, how?
A lot of people come in already having Medicaid before their SSI is ever approved. So that might throw your numbers off a little bit.
Right. Okay. Well, I'll look at this again and kind of simplify it as much as I can. I mean, ideally, I kind of want to make it just like a front and back of a sheet, so it's not as like intimidating for some people. Okay, and then the rest is, well, there's the collaboration, so please describe the collaborations utilized for SOAR during the specified period. So collaborations with hospitals, and these can just be like anecdotal, like I had trouble working with this hospital, getting documents. I had trouble getting my clients' files from incarceration, things like that. Because the more kind of feedback I get, the more I can help kind of smooth the process along. Yeah, so collaborations with veterans, jails, supportive housing, housing providers. Like for Restoration Society's case, you'd say like we work closely with like Harbor House, things like that. Collaborations with TANF for general assistance. And then on the back would be employment outcomes, so number of applicants working at the time of application, number of applicants working after approval, number of applicants in the SSA work incentive program, total income from work, that might be, and total number of persons for whom work income is based.
This would be that first section, working at any time of the application, so whether it's when you initially meet with them or whether, you know, by the time you submitted it they're working, or just any time.
Yeah, I would say anytime. And then the last section, just some additional comments that would allow people to say what challenges they met or what additional partnerships are recommended. So I definitely want to simplify this a little bit more. But anything else you think we should be tracking in terms of like success or anything that you think might be useful?
What about tracking like how much they get from their protective filing date, like their back pay? I don't know if back pay is the right term, but that might be an interesting amount to see.
So like reimbursements.
Sorry, I'm adding more to the numbers.
Okay.
So this is probably a dumb question, but
No.
do you want us to just track, so I tend to help a lot of people do Social Security applications, but obviously not all of them are homeless, but I still use the SOAR model regardless. So do you want me to track strictly individuals who are experiencing homelessness or at risk of homelessness, or track everybody since I'm using the SOAR model regardless?
I would use it only for the homeless and at risk.
Okay.
Because those are the clients that this process is specifically targeted for. I mean, you can use different elements to kind of help other clients. It's a lengthy process, but I mean, if you have the time, but I wouldn't, on the application, I wouldn't say like this is a SOAR application.
No.
Okay, cool. because then it would get to Leslie and she'd be like, wait, this isn't
No, I don't do that.
that.
Yeah, the only part I don't do for them.
Okay, great. Yeah, but I mean, there is an opportunity to track non-SOAR applications on OAT, the online tracking service that SOAR has. But for these purposes, I think we would specifically only be looking at the effectiveness for homeless and at risk. Yeah. But if you're using it and you're finding success in other cases, I mean, that's pretty great. Okay, so I think we can go on to the next item on the agenda, unless somebody else has another suggestion. Okay. So improving local partnerships. Now, we do have a couple identified partners in the community. Some of them have been more active than others. But I was just wondering if people, if you have any suggestions of additional partnerships. Right now we have Neighborhood Legal Services, which they said that they would help more specifically on the appeal process. We have Neighborhood Health Center, which would help scheduling different kind of health-related updates for the client, like if they need a physical update or kind of coordinating a mental health update, things like that.
Would they, do you think, no, well, I guess first question, when they coordinate that, is it typically like a one-time visit, or is it like they'll see them multiple?
It's mostly a one-time visit for the purposes of the application.
Okay.
Like say if you have a client, say if you have a client who hasn't been to a doctor in years, they're going to need some updated health information to really strengthen the application. So I would advise you to reach out to the Neighborhood Health Center and organize something, or if you have another partner like associated with Restoration Society, connect with them. But I can tell you right now that Neighborhood Health Center, I think they contract for consultative exams with OTDA, so they know exactly what to look for and to ask. Yeah, but I'm sure. I mean, Neighborhood Health Center, they're kind of like a clinic kind of situation.
Kind of rough if they're just gonna see him, find out there's a whole bunch of stuff wrong.
Yeah.
Have at it.
Yeah, I mean, I'm sure there can be like a follow-up if the client needs it, of course. But in terms of getting like updated health information, they're a good resource.
I was going to say, I mean, the answer to this next question is probably no then. I was going to say, so then obviously they wouldn't sign off on like an MSR or anything. That's the biggest challenge I find is getting the doctors and the health providers to sign off on that. And I mean, I get it, but it's like a huge challenge. I haven't found anyone who's willing to.
Talk to our contact.
The medical summary report.
Yeah, that long narrative.
I mean, and obviously it can be sent without their signature. They don't have to, but there's more weight, obviously, if there's a medical provider's signature on it as well.
Yeah, you're 100% right. Yeah, and that's something that is probably one of the more challenging things being seen like around the country is getting doctors to be like, oh, you wrote this like little narrative. Like if I sign it, then I'm affirming everything that you wrote. So they're a little bit more hesitant on that. So yeah, that's something we can definitely improve on.
I get it.
But if you talk to our Neighborhood Health Center, let's see, her name's, I'm gonna butcher her last name. Her name is Jennifer. Her last name is Mrozilski. It's Mrozieelski. And her phone number is 716-242-8600, extension 483. So she's they get funding for the healthcare for homeless funds, so that's why they're partnered with us on this, and yeah, I would definitely reach out to her to get some advice on that as well. And I'm just curious now, do you ever like reach out to healthcare providers to schedule something if you're a client now? Like what's your
No,
process?
so far the ones I've assisted have all had primaries.
Okay.
So I haven't run into that issue yet.
Great. Okay. Okay, so any other kind of useful partnerships you see in having? I mean, more connections with the hospitals and healthcare providers I see as like a given. But any other kinds of, anything I'm not thinking about?
I mean, I don't know if it would be a partnership, but I think too, when you have customers or clients that have been incarcerated and you're trying to get those records, some of the jails and prisons are a lot better at sending them than others, and like some just never respond. So
Yeah.
I don't know if it's maybe just making them more aware of SOAR, or I don't know, like something with that though that would be helpful.
Yeah, I've been down that road as well, and a lot of times it's just like, oh, file a Freedom of Information report, and maybe you'll get it. But yeah, that's definitely something that needs to be improved as well. Okay, so I mean, the next item is just Q&A with SSA. If anyone has any questions for Leslie. Have you seen any like SOAR applications? Do they come in pretty often, or
It seems like we have
a lull?
you know, an ebb and flow kind of thing. I mean, sometimes they're like constant. I'm not seeing them as much since you guys stopped with the lead thing, so that kind of helped me out personally. But, you know, so I would get a lot more leads than I would get claims a lot of times. So it would start out and then something would happen with the person. I don't know if they were incarcerated, you know, moved away, whatever their story is. So the person would locate them, fill out the lead sheet, and then no claim would come as a result of it.
Oh.
So I was seeing some of those. And now about the lead sheet,
Mm-hmm.
which, like I said, is great for me personally, you know. But so then I don't know, you know, when the claim comes, it comes. Kind of forward.
Yeah. So the lead sheet you're referring to would be that
I would go look at the case and see if it was pending or whatever. So now I guess you guys are using the online services for that piece. So that I'm not.
Yeah. So yeah, and that's worth mentioning that SOAR they have to reevaluate that consent form that was establishing a protective filing date. We were telling everyone who was SOAR trained to just fax in this form, and that would set up the protective filing date. So right now that's not the case. So so we're asking people to set up a protective filing date in other ways. You can either like call up Social Security, or you can go in yourself, or you can start it online. And that's those are the other options right now. But I'm sure they'll probably figure that out and re-release the consent form at some point in time, so we can have that process and make it harder on Leslie.
I found the consent form helpful.
Yeah.
In a way, it was a quick way to know like whether they had something pending already or whether they, since I read
I mean, if I get the release, I'll still do that for you, but I have to have the signed release from the client in order to do it. Right. It is time consuming. It's worth it, I think, because you don't want to go down that road and they've got a claim pending already. That's crazy. So.
Right. Okay. And I know, Leslie, this probably isn't from your office, but I know I talked to Karen from Gerard Place, and she said that she has some like appeals pending.
Oh yeah.
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 And
nothing we can do about it.
Yeah.
The hearings office is backed up probably about 3 years. So, we put the flag on all the cases that she has talked to me about.
Okay.
There's a flag on it.
And that's all.
I mean, I can't call up the judge and say, you got to hear this. You know what I'm saying? She can call up the judge, and
Sure.
the person's attorney can call up the judge and say, we have compelling reason for you to hear this case. Now, will they or won't they? That's between them and the hearings office.
Right.
They're suing us at this point, but no, it's an administrative hearings.
Yeah.
No, but no. So,
Okay.
I mean, I don't have any inroads to getting it heard any quicker. We
Sure.
put the flag on it. You tell us more stuff. We type it up and send it over to them.
Okay.
Their internal process of, is anybody looking? Is this thing on? I don't.
Okay. So maybe I'll probably advise her to reach out to Neighborhood Legal Services then.
Yeah. I would
Yeah.
say, yeah. That sounds a good idea.
Okay. All right. So, any other comments for our Social Security rep?
I have a question. So in terms of submission, do you prefer that we schedule an appointment with you to turn in, or just kind of go in and hand them to whoever?
As for me, I'd rather you just fax. I still prefer the fax.
For the actual whole application?
Oh, for
submitting.
Yeah,
submitting.
I thought you were asking about the leaving. That whole.
So I usually just go in and just.
Yeah, drop it. I mean, if that's working for you, it's getting done. I mean, you have a little bit of a wait because you got to pull a number, right?
Yeah.
Yeah. I don't have a way around that, really. Kind of frown on us going up there and calling somebody to the side door because it gets the date. It's kind of restless. They've been waiting in the bullpen, so we can't. It can be an ugly thing. So yeah, I would say if that's working, is that okay for you, or do you need something else, or?
No, it's fine. I just usually tend to wait till I get a couple things so that I don't just constantly go around. Because there's the wait.
I mean, you're saying mailing is not good for you guys. So, I mean, because you wanted to get there quicker, is that, and you got all that stuff with it. So, I mean, that's fine.
How long would it take for a fax, faxing the application to get processed?
Dude, you don't want to the quality of the fax machine, the number of faxes that we get. People do it, but that handoff in the envelope, everything's there together. At least you know that we got it all.
Okay.
Supposedly we got it all when it was faxed in, but maybe, when the person's separating, the items. So the more stuff that you have, and the more hands that have to touch it, the worse it can get. So, I mean, I that all in one envelope and bring it in.
Okay.
I can see if I can try to work something out. And you're using us most of the time, because you have a lot of 10s too, don't you? West Seneca?
I've only had like one. I
No,
think.
okay. Yeah, I can ask and see.
Me too, parking.
Right.
I know, right?
Or if you have like a mailbox.
I know we don't do that. Yeah, let me, brainstorm that one. See if I can get you an easier way. How long are you waiting?
I don't wait too long, to be honest. It's usually never more than an hour.
Oh, shit.
I know. No, I know. Like,
I'm
compared to
sorry.
like other people, an hour's not bad.
Done.
So an hour isn't bad, so I'm not complaining.
Okay.
It's just,
That's good to know, because I can let them know. No,
that's because I strategically go at like 3 o'clock or like 3:30. So that could be
The end
why
of the
too.
day.
Yeah, like I never go at like 10 a.m. or anything like that or 1
Yeah.
o'clock. I always wait till it gets like closer to closing time. Oh, wow.
And all you would do, like once your number's called or whatever, you just
slide it through the little window.
and that's it, right? That's
So I usually like go through it and all that because I like to get
okay.
the stamped copy like for proof of submission, but yeah, it's not like a long process.
To a 2-minute interview for an hour wait.
Mm-hmm.
Yeah.
Pretty much.
Yeah, I mean, and do you think that's like a process maybe?
I can't say.
Yeah,
because
that's fine.
I really can't, but I can take it to
Sure.
the management. See if we can
Appreciate
work out
that. Awesome. Okay. Any other questions, comments, requests?
something else. It was a good report.
Yeah, that was good. Okay, well, I think we can end the meeting then. So I'll work on this. Our next meeting, I would put it on the schedule for August 22nd. It's in 2 weeks or 2 months. It's a Tuesday. Same time, same place, kind of situation. I'll get more people to come to the next one.
Do we have that directory yet for all the SOAR certified providers?
Yeah, there is a directory, but at the last meeting we kind of discussed possibly just referrals kind of coming through me.
Okay.
Because there has been a lot of turnover, some agencies not having people who are SOAR trained anymore, and like the turnover rate is just kind of pretty fast. So yeah, if you have somebody you want to refer to or a question, just email me and we can work it out. Like if somebody comes to you who they don't have like a mental health diagnosis or something, yeah, I can help you with that.
Okay.
So right now I do have a list, but I don't know how useful it would be in like a couple months.
Okay.
And so yeah, just contact me and we can work it out.
Okay.
All right. Cool. All right. Let's end the meeting. Thanks everyone for coming.
Thank you.